Should doctors be allowed to provide a life-ending prescription for terminally ill patients who request it?
Absolutely.
Why do you say that?
I think people who have a short prognosis have the right to determine when they want to die, if that's something they want to decide.
So you feel that way if somebody has a terminally ill diagnosis.
Yes.
What if somebody has significant autoimmune disease and they're suffering? And it's not going to kill them, but they suffer every day of their life.
I know there's all these nuances of this that get difficult. We know what the law is here.
Here is in California?
In California and across the nation is that people have to have a terminal diagnosis. They have to have 6 months or less. They have to be of sound mind. And I think all of those are protective safeguards to make sure that only the sickest are utilizing this option. When we look at chronic illness, I think it gets a little harder to decide what that determining factor is. What I think gives people some comfort is how clear the law currently is written, and I think it's a little harder when we get into the nuances of not quite. Now that person may eventually get to that 6 months or less. I have mixed feelings on that one, to be honest. What do you think
about the terminally ill part?
Well, yes. First, I'll ask about
terminally
if you think
ill? Do I believe people should, physicians should be able to prescribe medications to allow people to die comfortably? I probably would say yes. I think we're kind of getting into medical aid in dying, right? The ethics of medical aid in dying. You just maybe I literally just thought of my ethics professor at the University of Iowa, where I went to medical school. This guy was so arrogant. He went to like Yale, and he would always say, when I was in New Haven, like anybody that goes to Yale always says when I was in New Haven. They never say I went to Yale, right? They want you to know that Yale's in New Haven. Look, you're not Harvard. Relax. Anyways, so medical aid in dying is what we're talking about, right?
Yes.
Kind of? Yeah.
Yes.
I've never done it. I have allowed people to be comfortable. I give them morphine. I've given them benzodiazepines, which are medicines to calm down your neurologic system. Morphine keeps you comfortable and relaxed. The way that I look at it, that allows you the comfort necessary to move from this stage of life to the next. I'm not assisting your death. I'm allowing the natural process of dying to take place comfortably. That's how I've explained it in my head. But when I went through medical aid in dying, right, thinking about this, and looking at the medications that are given, basically as an outpatient, right? Diazepam, phenobarbital, amitriptyline, morphine, digoxin, right? You give lethal doses of these 5 medications and allow the person to die, basically, right? You need 2 physicians to say it's cool, and the person needs to be of sound mind and body. If they're not of sound mind, you get them evaluated by a psychologist. And if the psychologist says, nope, they can make their own decision. And if they have 6 months or less to live, like they can do this, right? Is that?
Right. In California, you have to be a resident. There is a wait period between the first time you ask and the second time you ask, which is not anymore. It's only 48 hours here in California.
Oh, it's only 48 hours now?
Yeah. But 90% of medical aid in dying participants are on hospice. So it's not just outpatient.
Yeah.
You have a whole team of people with eyes on this person in this situation, which I think is really helpful with making sure that, there isn't any coercion, no one's being pressured to make this decision. And so we know with cancer patients that, they've typically, when they come out of hospice, they have a terminal diagnosis, prognosis 6 months or less. They've gone through hell. Some of these people, I just met a patient he's been in treatment and doing trials for 7 years. He weighs about 80 pounds.
Yeah.
And he said, I can't do this anymore. I can't do this anymore.
Yeah.
And so at that point, that is an opportunity that if he wants to make this choice, it's kind of similar to the medication, like medicate me like a unicorn. Like I've had my time with family and the families will often tell me, I can't watch this anymore. I can't do this anymore. Like, it is excruciating watching this person deteriorate like this. And then people tell me, we put our dogs down. Why can't we put our people down?
Oh,
Now,
it's so hard though. Oh my gosh.
they say that, and I say, well, we don't put people down. We don't euthanize, because euthanizing is when the physician is actually injecting the person with a medication. Here in the United States, medical aid in dying is drinking a liquid, but they have to be able to say all through the process, I want to do this. This is my choice.